So I'm Dr. Rashmi Chakraborty. I am a child and adolescent psychiatrist, and I practice in Oxford at the Priory Wellbeing Centre. I offer both online as well as face-to-face appointments. So it was completely by chance that I became a psychiatrist. After I graduated, I wanted to do ophthalmology, but when I started training in it, I realized I had a problem with my own vision that made depth perception under microscope quite difficult for me. And I didn't want to stay in a specialty where I had a handicap, so I decided to change. Around the same time, we moved to UK from India, and I was thinking of what to do, and I identified two specialties which I used to like as a medical student, and I thought I'd give them both a go and then decide which one to go for. But I had a small child and I didn't want to apply for jobs further afield. I needed a job local to my area, and as luck would have it, a job came up in psychiatry, and I thought I'd just go for it. And I applied for the job, got the job, and absolutely loved it. I liked it so much, I just realized that I had found my niche. So that's when I decided to train in psychiatry, and 25 years later, I'm still doing psychiatry, and never in my life once have I regretted my decision. So when children whom I am seeing grow up and go out into this world doing apprenticeships, going to university, just going into life happy and as individuals attaining their full potential, it really gives me a lot of joy. And when I see a sense of relief on the parents' faces, that is incredibly invaluable to me, because I'm a mother myself, and I know how much parents suffer when their children suffer. So just making parents happy and relieved that their kids are doing well, it gives me immense joy. So when patients come to me, they can expect a thorough assessment of their needs, which is compassionate and involves both the children and their parents. Once I have assessed them, I then come up with a plan to help them. And that plan is always made in collaboration with the patient and the patient's parents. So I would never say to a patient, this is what's wrong and this is what you need to do. I would always come up with options, discuss with them, and then come up with a plan that is agreeable to all of us. And when things get difficult, as sometimes they do, for example, some patients are hard to treat because they don't respond to treatment, or the situation is very complex. In such situations, I take my cases to peer supervision, where I discuss it with other specialists on a no-name basis, because somebody else might be able to think of an option which perhaps hadn't come to me. So I don't give up very easily. I try my best to help. And if I ever fail, which is rare, but if I do, it's not because I haven't tried or given it my best.